So welcome everybody to the Q&A session today. Thank you for attending. We're going to record the session so that people that were unable to attend have the opportunity to listen to this at another time. So we've got a number of things on the agenda today. As you know, this meeting is specifically around infection control and guidance. So we'll be talking about everything that was on the agenda. And Amy, just to say welcome, Amy, because I know you've just arrived, Amy. I don't know if you're able to say hello, Amy.
Yes, hello everyone. Sorry I'm a little bit late. My name's Amy. I'm part of the infection control team at the CCG.
Thank you, Amy, and we knew that you would probably be here at some stage today, so thank you for thank you for joining us, because I know everybody is being deployed and put on, you know, in various different roles, so thank you for joining us. Appreciate that. We've done our introductions. We're just beginning the meeting now, and we're just going to start on our first agenda item. The first agenda item was COVID booster vaccinations and the rollout. So just to make people aware that as you will probably all know by now, the booster vaccination rollout has been opened up to everybody 18 plus. There's only a 2-month wait between the second vaccination now and your booster. You're able to go on the NBS and book. Here in Norfolk and Waveney, they have temporarily paused walk-ins because they are increasing the number of supply options with GPs, PCNs, and larger scale vaccination sites. So there is more options available now on NBS and more capacity to receive the vaccination. I am aware that there have been problems with the website and it has crashed, but what I would say to anybody is keep trying. I know from our own team, Megan got through this week and has had her booster as a result. 2 other members of my team got through on Tuesday and they've got their boosters next week. And in my own family, my own daughter was getting rather frustrated last night, where it crashed about 3 times. We got it booked this morning. So in a different part of the country, I have to say, so you can see it's not just here in Norfolk it happens. But that's where we are at the moment. Now, does anybody on the call have any issues with accessing the booster for either their residents or their staff? Have you got any issues at all that we need to be aware of? Or are you all okay at the moment? I'll just ask a few people just so that I'm absolutely happy that things are running smoothly. Oh, we've got Dorrington House. Dorrington, is there somebody from Dorrington House?
No, I think they joined and then they've dropped off.
Oh, okay. I beg your pardon. I was going to say, I don't think I'd introduced them. So sorry about that. I'm just going to just go down my list just to ask. Raj, yeah. What about your home? How are things there?
I had one new resident and apparently she didn't have any boosters, so I've been in touch with the surgery and they'll be coming around for that, yes.
Excellent. And so have all your residents now had the booster, Raj?
Yes, everyone apart from this new resident.
Apart from that new, that's excellent. That's excellent.
And I'm not sure how that lady got missed out in previously, you know, but she must have been around somewhere else, you know.
Yes, so yes. You don't know where she's. Yeah, you don't know where she's from. Was she from the community or another care home?
No, she was based at Sheringham all the time. She lives in Sheringham, but well, how she got missed out from the surgery, I just don't know. Yeah. Anyway, I made the urgent request to get her boosted done. Yes. Okay.
Fantastic, fantastic. She might have been housebound, Raj, and getting to housebounds has been it has been quite difficult because obviously it's very labour intensive, and up until today you had to wait 15 minutes, so you get you see less people. They didn't have the capacity in the workforce, etc. They are catching up with them now, but it might well have been that reason.
Yes,
I'm really pleased. Yeah, really pleased to hear that she's getting that.
thank you.
Caroline, what about you? How are things there with you?
Yeah, we're fine, Christine. We've still got a couple that need it because they've not long had their second, but yeah, it's fine.
Okay, excellent, because that period between the second vaccination and the booster has now reduced, so that's something to bear in mind as well.
Yeah, will do.
Yeah, good to hear that though. And if you do have any issues at all, like you can't get through to the GP or you're worried about it, just drop us an email and we'll put it through to the right PCN from the vaccination planning team, and they will help us.
Okay, lovely, thank you.
Okay, Howard, how about you?
Yes, I think all the service users are done. I had mine this week, which is a bit sore, but hey.
Yeah.
We do have 3 members of staff that refuse to get vaccinated, so they haven't had the booster, of course. But apart from that, we're all done.
Okay. All right. That's really good. That's really good. So it's not, you haven't had any issue in terms of accessing it. So that's really good.
No,
Brilliant.
no, we're fine.
Fantastic. Thank you very much, Howard. And Ian, how about you? How are things going there?
Yeah, no, it's fine. In terms of the staff, I think there's only, again, a bit like Howard, the guys who haven't had any vaccinations obviously haven't had their boosters, but the ones who have had all their boosters apart from one who had his second one late. So
yeah,
I'm just in a project, and he tends to travel in and out of the country quite a bit, so his boosters are, but in terms of actually getting online and booking them, or again support some of our clients, we're proactive in supporting them to get their boosters, and that's always worked fine. So yeah, so no issues really.
Brilliant. Oh, that's good to hear, Ian. Brilliant. Well done. Raj, how about you? I think everything's okay at the moment, isn't it, Raj, with you?
Yeah, Trina might be able to answer that.
Oh yeah. Trina, are you able to?
Yeah, no, we're fine at the moment. Everything seems to be going swimming, and we're getting the GPs to arrange for anybody that's been coming in and not been picked up previously. So yeah, no issues at all.
Excellent. Oh, I'm so pleased it's running so smoothly now after a few hiccups at the beginning. But this is really good to hear. And until you ask people, you're never sure. I've got St David's here. It seems wrong to say St David's. Are you able to say hello there?
Oh, you're on mute. There you go.
Hello.
Hello. Do you want to introduce yourself?
Yes, my name is Marcela Ciucă, and I am the manager of St. David's.
Yes. Oh, well, welcome, Marcella. Marcella, can I ask you, boosters for your residents and staff, how has that gone? Have you got any issues at all?
We did have a few issues, right? Some of the residents are not due yet, so they will be probably next month. But most of them are vaccinated, right? And with the flu jab, we had a little bit of a problem because for some reason the surgeries kept delaying, canceling the appointments and then delay. But we only have 2 members of staff for the flu jab left, and 3 residents for
that's very
3
good
residents for the booster.
Marcella, that is very good considering the issues at the beginning. That's extremely good. I'm just going to bring in either Amy or Rowan, anyone from the CCG here. In terms of, Can I just check, Marcella? You said they haven't had the gap between their second vaccination and the booster. How long ago did they have their second vaccination?
About 5 months and a half.
Can I just bring in Amy or Rowan? Can I just check with you? Can residents now have that booster sooner?
I might need to check that actually, Christine. It's Rowan here. I'm really sorry, I don't have that information at my fingertips, but I can certainly bring that back to you straight as, you know, get that after the meeting. I don't know if Judy or Amy knows.
I think they've brought the gap down to 3 months generally, and I think that's across the board. I'm not aware that there's exceptions for the elderly at all. That, you know, they've said it for the younger populations, they've brought it down to 3 months. So I would be presuming by saying it's across the board. I've not heard it's not, but it'd probably just be worth us just double checking.
We'll double check. Yeah.
I can't see why it's any different. In fact,
oh, Amy's put something in the chat. Let me just have a look.
Oh, she has. Here we go. Amy, did you want to come in, Amy, just so that you can just explain that?
Hello, yes, that's just to say, obviously there are an awful lot of different conditions and provisos to accessing the booster doses, so it's probably just best. This is literally lifted from the NHS website, but obviously it gives all of the different conditions about being aged over 18, living or working in care homes, etc., etc. But it does say that the second dose of the COVID-19 vaccine only requires a gap of 3 months before the booster. So it's definitely worth running through the checklist, but I think as a general rule it looks like it's 3 months.
So Marcella, what I was going to say is you would be completely okay to go back to your GP and ask to come in and get the booster for them.
We will, yes, we will contact the GP.
Thank you.
Thank you.
That's brilliant. That's absolutely brilliant. Where had I got to? Susan Bailey. Susan, they're from Iceni. Hi, Susan. That's it.
We've all had our vaccinations and boosters and flu jabs.
You have.
Yeah.
Good. So no problem at all there. All hunky dory.
Yeah.
Excellent. And I know there was one person that needed to get their second vaccination in a shorter time, but that was all resolved as well, wasn't it? You may not know that. I spoke to somebody else at IC. Yeah, that's fine. Yeah, that's absolutely fine.
Home.
Yeah, that's absolutely fine. Thank you, Susan. That's great. And we didn't have anybody else join the meeting then. No, that's fine. Okay, so I think things are going very well. I do know we had some issues with flu as well, accessing flu vaccinations. There was an issue about the shortage of supply to begin with, then there's been more supply. Then, as I think Marcella was saying, you know, there was issues about staff capacity as well. So not being able to come out and cancelling things. Megan's had the same issue for herself, you know, lack of capacity to deliver the vaccine. So what I would say is please still encourage staff to take up the flu vaccine, because obviously a great amount of effort's been put into the vaccination, the COVID vaccinations and the booster. But we mustn't forget that there are other respiratory illnesses which can be fatal. And so the flu vaccination still remains important. I don't know, Judy, would you want to say anything more, Judy or Rowan, around that flu vaccination?
I mean, yeah, we can't stress enough really how important it is. We know that, I mean, for instance, last year, the UK Health Security Agency, formerly known as PHE, reported that there wasn't one notified case of influenza in a care home in the whole of the east of England because of the restrictions we were under, you know, partial lockdown, all the IPC precautions. Obviously, things have opened up a little bit now this winter, and we're really worried that we could potentially see a really bad flu season, because you know we've been so lucky last year with our precautions and no cases. So it is really important that your staff and your residents are protected, because the mixture of flu and COVID together is really quite worrying. So yeah, I can't stress enough. There's some really helpful videos and tools on the CCG website, so if you've got staff that are concerned in any way, by all means contact myself, Rowan or Amy. We can signpost you to some of those, because actually it's worth reminding your staff that it is obviously about protecting their residents and their families, but themselves as well. There's a really powerful video that we've been showing from 2 nurses actually, whose brother, who was, you know, a young man with a young family, very close to, you know, he had to be on ECMO, a specialist hospital. He was so ill, they thought he was going to die. So I think, you know, flu kills, and it, you know, unfortunately fit healthy people sometimes are susceptible too. So it's not just about protecting residents and family, it's yourself as well. So I can't stress that enough. Rowan, did you want to add anything?
No, absolutely agree. As important, if not more important than ever in the current climate. So yeah, if anybody has any doubts, if they want to speak to us, then that's fine. Absolutely, yeah, paramount this year, I would say. Every year, but even more so, I would say, this year.
And it's interesting that sorry, Cassie,
it's okay.
I know this is for healthcare, but the new healthcare guidance for infection prevention that's just come out, and I know you've got separate for care homes, but it's interesting that they've reworded it to say it's for respiratory illnesses, not just COVID anymore. It's to encompass the flu season as well. So you know, we know last year how successful the mask wearing, the good hand hygiene, the environmental cleaning, all of those measures will help to reduce the spread of flu viruses as well. So it's all respiratory viruses. So all the things that you're doing, good infection prevention and control procedures to help prevent the spread of COVID, will also go a long way to help prevent the spread of flu. But obviously that vaccine is as important as well. Thanks.
That's really helpful, thank you. And I noticed in here, I'm sorry, I'm just going to pop in the chat box. Really helpfully, I think you've got in the chat box there, Megan's popped in the Norfolk and Waveney website with flu information, and I've also popped in our information hub as well, which has got all the flu vaccination resources in there that you might be able to look at as well. And I think in there as well is one of those videos you talked about, Judy, as well. But yeah, so there's plenty of resources about. But if you do have any queries, then do go back to Judy or Rowan, or contact us, and we'll send on any emails to them. I really like in here, Raj has put, we've offered all staff a £10 payment for the booster and a further £5 payment for the flu vaccine as an incentive. And I think, to be honest, if you can encourage people to take it up, do so. I think, Raj, that's a fabulous idea, and I'm sure, you know, it does encourage people. Did you want to come in, Raj, and say something about that? Oh, just
Raj, you're on mute.
I think any sort of incentive has got to be positive, and I know it doesn't sound like a lot, but we've all got infection control grants that we can use for that purpose, and if we can feed that back to the staff and give them an incentive, you know, every little helps, doesn't it, at the end of the day? And if it encourages that last person to go out and get it quickly, especially when we put deadlines on it, and we've done that in the past and people have missed the deadlines, and we've been a bit harsh and said, no, you missed the deadline, but the next one, then they've been very quick to do it. And we've sort of done it in newsletters and reintroduced it, said last chance to claim it again, and then suddenly everybody's on the ball. And it also encourages people to read your newsletters as well.
It's a good point.
Yes. Other information that's in there. So other important information that we supply staff. It's the only way to communicate effectively. So I think the take up has been pretty good. So it virtually means everybody will get it regardless, you know.
Yeah.
It's a good test of who's.
Sorry, Christine. Sorry, no, go on, Megan. No,
I was going to say it's a good test to see who's read the newsletter as well.
It takes one person to spread the news, and everybody reads it. Then so sometimes they get a bit long, and people get them, and we get hundreds of newsletters. Everybody gets them in their inbox, and you think, I'll read that later, and you never get around to it. But suddenly, when someone says, "Have you read the newsletter?" You're going to get £15, or we did another one which is not sort of relevant to this. We offered everyone £200 if they fulfil all their hours, contracted hours in December and January without a period of sickness. So that's obviously quite a big one, but it means if it gets us through this these winter months without people saying, "Oh, I'll take a few days off sick," it goes a long way. So ultimately they can get £215 in paid to them in first week in February.
That's fantastic, and it's giving people ideas, Raj, as well, because this is a recorded session. People may come in and think, oh, actually that's a good idea. Well, particularly around the boosters and the flu vaccinations, incentivising staff. So thank you for sharing that. That's great. I think we've covered the flu and the booster, so we'll move on to the next agenda item, unless anybody has got anything else to add. Don't think I've seen anything else in the chat box. Oh, Megan's cat's joined us.
He just seems to sense when things are being filmed.
I think he's yes, I'm sure there is a pun there somewhere. A perfect actor. Anyway, that might have got lost in the ether. Right, let's go on to self-exemptions extension. We do know that people have been able in care homes to self-exempt, and the idea was that the self-exemption would carry on till the 24th of December. But there has been new guidance that has allowed that to be extended now until the 31st of March. So I just wanted to make people to be aware of that, so that if you have got people that may still have issues that are unresolved, they can still fall under self-exemption until the 31st of March. And again, Megan has just put the guidance into the chat box. And I just ask everybody or anybody on the call, has that caused any issues, or are there any concerns about that at all, or is that good news? I'd be interested to get your feedback on that.
Sorry, I'm on a couple of other forums, and the feedback generally tends to be that if they don't have any sort of medical conditions that they can exempt from, it doesn't really matter. And I think, without getting political, it was just to realign it with the NHS dates. And to be quite honest, those that wanted to leave have left. Yes. I think we've got two ladies that were used that as because they were pregnant and gone on maternity leave anyway. So I think it's probably too little too late for a lot of people. And there's not really a great deal we can do. And those that will use it will obviously, each home has to look at it on an individual basis, really.
Absolutely, Raj, and take your point. I guess for anybody that's coming in that's new, that might be relevant, but for existing staff, like you say, it's not so relevant now, and it is a bit late in the day after people have left. So, yeah, and I would suggest that it was to align with the wider health and social care market to get the dates the same. But we are where we are, and that's what we've got. And I just wanted to make people aware of that, so that you are aware that does exist. staff can use the self-exemption up until the 31st of March. And if you do have any queries or questions following this that you think of, do email them to us and we'll chase them up. We've got somebody else coming in. So we'll just say hello. So I think it's, does it say Moyo? Moyo, welcome our new attendee. Is that Moyo? Do you want to come in and say hello?
You are on mute. And if your microphone isn't working, do feel free to pop something in the chat. If it's oh, there we are. Hi,
yeah.
Yes.
I can hear you.
Hello.
Hello, welcome. Do you want to just introduce yourself? Did you want to introduce yourself?
My name is Gibbs Humphrey Moyo. I'm the registered manager at Comkey Healthcare.
Oh, okay. Thank you very much. I might have got your name the wrong way round, so I apologise about that. So
Thank you, no
Gibbs.
problem.
It's Gibbs.
Yes, Gibbs Humphrey Moyo, yeah.
Gibbs, welcome, Gibbs. We're just going through the agenda, and we've just gone through vaccinations, booster vaccinations and flu vaccinations, and we were just talking about self-exemption. So just to check with you, Gibbs, have you got any issues at all around boosters, flu vaccinations at all with either yourself, your staff, or your residents at all?
At the moment, we don't have any issues. We have started our vaccinations. 2 people have had their flu vaccinations now, and on the boosters as well, we have got 4 people who have had their boosters. So we are just waiting for the invitations from NHS for the boosters according to how people have been vaccinated before.
Okay.
Yeah.
Is that your staff or is that your residents?
Yeah, all the residents have got, most of them have had their boosters, and they have been contacted by their GPs independently, not through us.
No.
Yeah.
So it's your residents, and are you still waiting for them to have their booster?
Some of them have had the boosters have started already. Yeah, so some of them have had their boosters. But with the carers, it's only 4 who have had their boosters up to now, and we are waiting for the others to be invited for their boosters through the NHS and the GPs.
Yeah, no, that's absolutely fine. If you do have any residents though that are waiting for their booster, please do let us know, because they are priority, and we can make sure that either the PCN, the GP, the vaccination planning team are aware. So if you do, and you've got any issues about residents not having access to the booster now, please do let us know, and we'll try and facilitate that happening for you. So that was that. And then we were just talking, just to raise people's awareness of the self-exemption scheme, which has been extended now until the 31st of March. So it's really just to make people aware of that, because obviously it was due to end on the 24th of December.
Yeah.
It's now extended until the 31st of March. So just making people aware of that.
Okay.
Okay.
Thank you.
That's okay. We're now on to the 3rd agenda item, which is about the variant concern at the moment and Omicron. And I just wondered if I could defer to my health colleagues here about what you might be able to tell us, whether you can tell us about what is happening in Norfolk. I was this morning. I don't know if anybody heard, but I was talking about visiting in care homes. But prior to this, James Bullion was on Radio Norfolk, and they were asking him about infections in Norfolk. So I just wondered if it would be possible to sort of update us, Rowan or Amy or Judy.
Do you mean about the number of cases that we know about, or of Omicron? Well, we do know that there are a handful of Omicron cases. We do know that we're aware that there are small numbers at the moment of Omicron, and we're aware that the people that have confirmed cases aren't displaying particularly severe symptoms at all. The symptoms are quite mild. We're not aware that anybody is particularly poorly, and I think that is probably the case across the country. Actually, most people are at the moment displaying quite mild symptoms. We do expect Omicron to become the dominant variant in time, which it isn't at the moment. The Delta variant is still the dominant variant, but Omicron is likely to take over in the next few months, I think. And it is more transmissible. It is more spreadable. It spreads more easily than the Delta variant. So infection control vigilance at the moment is more important than ever, I would say. Don't know if you want to add anything to that, Judy.
I think Judy's on a call at the moment, Rowan.
Yeah,
so
yeah.
I don't know if
got any questions at all.
Yeah, or Amy. I think Amy is Amy there still? I don't know whether Amy could come in as well if she wanted to say anything.
There might not be that much more to add, probably at this stage, unless people have got particular questions.
Yeah,
there's still a lot being found out, I would say, about Omicron at the moment.
Raj has his hand up.
Raj.
Yeah, a couple of things. I mean, my understanding was that it was literally a matter of hours, if not days, before the new variant became the dominant variant, because it's doubling every couple of days.
It's rapid. Yeah, it probably will become dominant fairly quickly. Yeah.
By the end of the day, from what I hear.
Okay, right. You might be more up to date on that than me.
I'd like to understand, how do they measure that? Is it through the PCR testing, or?
Well, they can detect the Omicron variant. Not every type of PCR test definitively tells you if it's Omicron, but there are tests that can tell you if it is Omicron. Yes, and there's the PCR tests. Some of the PCR tests do something where they tell you that it's a suspicion of Omicron, and then they go on to test it to confirm if it's Omicron, if that makes sense.
And do we have sort of specific figures for like Norfolk, or is it just a national?
There will be data for Norfolk. I haven't seen the most recent data. I do know that there's, as I say, there's a handful of cases, and probably the reality is that there's probably more that are obviously undetected. At this
arrives a little bit later than everywhere else, because we don't have a fast track motorway up here, so.
No.
Yeah.
We're a bit more protected here, aren't we, Raj?
Yeah.
What about the hospitals and things? How are they faring in Norfolk?
The hospitals are not faring too badly at all, actually, because at the moment, still the main group of people that are positive cases, that obviously there's very large numbers of children are positive, because we have large numbers in schools, and actually at the moment the elderly population, we haven't been seeing such high numbers, but sort of 16 to 40-year-olds there have been cases in. The very latest data I haven't seen this week, Raj, so I'm not absolutely sure, but in terms of the hospitals, the admissions with COVID have gone up slightly, and the hospitals, for all sorts of other reasons, are absolutely bursting and at full capacity. But in terms of positive COVID cases, they've only gone up by a very small amount over the last few weeks. So they're not being inundated with COVID admissions, is what I'm saying at the moment. But all of the hospitals are with normal winter pressures and with people coming in with chest infections and all the other things that happen in winter. We haven't seen a lot of flu, but always at winter, you know, people come in with chest infections and whatever else, and the hospitals are struggling with beds, with bed availability.
Yeah, and I think, Rowan, there was a letter that went out last week, I believe, to all care providers about capacity issues. I think you must have received that, Raj. Before I speak to you any further, I've just got another hand up. I believe that was Caroline. Is that you, Caroline? Caroline, come in.
Hi, Rowan. Just
Hi.
a bit of advice if possible. I have 3 residents that want to go out and access the community freely and independently. However, all 3 of them don't wear their masks when they should. And 2 of them specifically socialise in other people's houses, obviously without masks. Can you give me a suggestion of how to manage it with this Omicron when they come back to the home? We do PCR them every week. We do LFT them twice a week. But Tuesday and Wednesday, when I did my PCR tests, the site was down for registering them.
Okay, so you would normally test them straight away when they come back, would you?
No, not every day, but they either get PCR'd on a Tuesday or a Wednesday because they're the days that we do our staff and the other residents. And LFT we do twice a week, but I'm just a bit concerned now at the rate this Omicron is sort of going on.
Yeah.
Can I just check with you, Caroline? What provision are you? Are you actually residential or supported living?
We're residential.
So you're residential.
But mental health, and we have quite a few that go out in the community, but these 3 have chosen not to take the safe route and stay at home.
Because the new visiting guidance does talk about people going out in there, and it is recommending that people, you know, if they're double vaccinated, I mean, I'm sure that this would fall into this, would it not, Rowan? The new guidance?
Sorry, what were you going to say? They're recommending what, Christine? For visiting?
So if someone is going out that is double vaccinated that comes back into the home, they have to take a PCR test, and then they have to take, I think it's LFD test. I'll have to go back to the
daily LFDs. Yeah, I will
daily FDs. Yeah,
I would need to check that, but yeah, I would say that they would definitely need to take a test on their return, Caroline, and I think they would need to take daily LFDs as well. But there is new guidance just come out, and I will need to just confirm that as well.
Okay, the link up for that, because I'm not sure if I've seen it yet.
Megan's just put that in there. So that's the new.
Look now, Christine.
Yeah, the visiting guidance in there. You have to go down where it says residents going out, and there's 2 different rules. One if they're double vaccinated, and one if they're not double vaccinated. And if they're not double vaccinated, you are talking about isolation. So you really do need to read that and just make sure what they're doing, and also the new testing regime for that. And that came in, Caroline. We sent it out yesterday in our bulletin. It came out. We sent it out on. Sent it out on Tuesday.
I think it was Tuesday.
It came in Tuesday evening, Caroline.
Oh, so
to be implemented Wednesday. We put it on our Twitter, and it will obviously go in today. But people will probably be struggling to keep up with all the changes. It actually it was published. Excuse me, just a moment. it was published on Tuesday late afternoon, early evening, to be implemented Wednesday morning.
Ah, well, I wasn't in on yesterday, so that's why I haven't seen it.
And Caroline, just so you know, on the link I've popped it in, it's number 2.4, visits out of the care home, and it's just over halfway down where it's got all the information you'll probably need.
Thank you. I'll have a look at that now. And yeah.
And we've got Marcella, you're typing. Did you want to come in, Marcella?
Sorry, my message was a little bit long. So what I wanted to mention is that we received the latest update today, this morning. Apparently, the staff will need to be tested with LFT tests 3 times a week now, and 1 PCR. And the residents who have not had 2 or more doses of vaccine, but they undertake visits out, they will be tested for 14 days, every other day for 14 days. LFT tests. Yeah. This is the latest.
Yeah, that's right.
Update.
And that's for people that are double vaccinated. Marcella, have you got there where it says about if they're not double vaccinated?
No. This is for who is residents who have not had 2 or more doses.
Right.
Okay. Yeah.
I've just popped that in the chat. Shall I read that out for everyone?
Yes, please.
Yeah. So it says care home residents who have had 2 doses of vaccination or are exempt from vaccination should not have to isolate for 14 days after most visits out of the care home, but should take a lateral flow test every day for 10 days following the visit out. Care home residents who have not received at least 2 doses of the vaccine and are not exempt from the vaccine should not go on visits out of the care home unless they isolate for 14 days after the visit out. This is necessary. This is a necessary precaution following clinical advice in light of more transmissible COVID-19 variants.
There we
So
are,
that
Caroline.
answers it, doesn't it? Yeah.
Yeah, I've popped that in the chat as well.
Lovely. I can't see one of them being very happy with that.
No, I'm sure, Caroline, it is really tough when you've got particularly working age adults with more freedoms. It's really tough. I absolutely understand that. But it was brought in response to the Omicron variant and the rapid spread. So it's a way of protecting the most vulnerable. They won't see that, but obviously that's what the reason is behind that.
Lovely. Thank you all.
That's okay, Caroline. I'm glad we could help as well. Okay, was there anything else around that? I know that. Sorry, Raj.
Yeah, I was just going to ask. I heard early this morning or yesterday, I can't remember, that some of the Barchester homes have closed their doors to visiting because of what's happening. Now we've got this new visiting guidance, which is very much based on government sort of public opinion of what they can and can't say. At what point does the local authority then intervene and say, look, cases are really high, we've got to go into some sort of protective measure over and above the guidance? You know, I know if you get a case or if you get an outbreak in a home, that is the case. But I think many people are scared and caught between a rock and a hard place, between allowing the freedom of visits and also the fear of an outbreak, because it's sort of devastating for everybody. You know, one death is one too many, and nobody wants to take that risk.
What did you do in the previous peak, Raj? Did you
actually
visiting completely? Or?
Yeah, we basically, I mean, right at the beginning, back in March, we actually sort of closed our doors, as it were, literally about 10 days before the official sort of announcement, only because of fear of transmission into the homes, and we took that decision quite early on. After that, yes, we've followed the guidance best we can, and obviously if we've had an outbreak, but I guess for a lot of homes the issue is that you get one case and you close that home down, you can't reopen it for 28 days after the last sort of positive sort of or clear sort of day, and that puts a lot of providers in jeopardy in terms of their ability to take on new residents. It puts people's lives in danger, and the staff as well as the residents. We're treading a very fine line here, and I know everybody wants to do the right thing, but providers are fearful of effectively the safety and well-being of their staff and other residents, as well as I guess the financial implications of having to close your doors.
Yeah. Just I think you're absolutely right, Raj. People are really anxious about this.
We've only got providers here, and I hear it all the time that the anxiety. Well, if we get it and we can't take on new residents. I mean, I know homes that are running at like less than 50% capacity and already struggling, and they're desperate to fill some of their beds, and they're fearful that if COVID comes back in the home, then they won't be able to fill any more beds for at least maybe another month and a half.
I suppose the thing is, it's about balancing risks against rights of individuals. It's always been about that. It's about trying to keep people safe, but also trying to allow people the rights to have well-being, companionship, which is always recognised as important, and they decline when they are isolated, and there's research that proves that. But in terms of the Care Act and the Human Rights Act and all of that, it's about allowing people and enabling people to have those contacts with people as well, while simultaneously trying to prevent them from risk of viruses and harm. So it's always a balancing act. And I think that the thing about the guidance is it's based on government advice taken through experts, through public health, through through you looking at data, and it gives local authorities and public health certain amounts of authority if in their areas they have concerns. Now, listening to what we've just heard today, we haven't got those concerns at the moment. But if we were, and the numbers were to go up, public health were worried about what was happening here, they have got the authority to make decisions. But as yet, as far as I'm aware, we have not got to that point. And but we certainly can ask our public health colleagues what might happen in those situations. Rowan, would you agree?
Yeah, absolutely. And we do have to remember that you do have now a population of residents that are vaccinated. So, that does definitely count for something significant. And it's a day-by-day risk assessment, really, as Christine says, and it's working with all the knowledge that you can get from external sources and weighing up what is reasonable. That's all we can do. Everybody is in the same situation of a sort of sea of unknowns, really, and it's about making common sense, practical, best interest decisions for your residents and for your staff. And there aren't any, but we can't see ahead even into next week, really. I mean, things are changing very, very quickly, and national direction will come out, local direction will come out, And as Christine says, we will get direction from our public health consultants that are that can make decisions about care homes.
They all
Sorry,
be
Raj.
will
Sorry,
they
Raj.
open throughout the holiday period?
There'll be cover, absolutely. Myself and Judy are basically on over Christmas with Amy and Ian, and likewise there'll be cover over the whole of Christmas. Yeah.
Can I bring in Amy, because I just noticed Amy's got her hand up.
Oh yeah.
Here, so yeah, thank you, Rowan. Thank you. Amy, you had your hand up. Yeah. Hi,
Yes,
Amy.
I'm so sorry. I'm back. I'm so sorry I dipped out for a minute.
That's okay. That's okay.
No.
It's a concern. People are very worried about it. It's about, this is like, oh, it's history repeating itself is one of the expressions that I've heard recently. But there are different factors here, and I wonder, Amy, if you can sort of just go over what Rowan's just said and add to that.
Oh no, absolutely. It was really just to echo what yourself and Rowan were saying about, weighing up that risk, and actually within the guidance, when you read through the section around risk assessments, it does empower the care homes to make that risk assessment. You are very much backed with the guidance. I mean, it is talking about even the individual layouts of the home, so how they have to cross, how much of the home they have to cross to access a certain area, and they really are sort of supporting that individual risk assessment for each resident and for each environment, which I don't think we've really ever had before. It has been quite generic, hasn't it? So yeah, they really are empowering you to kind of make that call about the level of risk for visiting. I mean, it does support the visiting hubs and things like that, again, in certain circumstances and things like that. So it's not to say that obviously the doors should be locked and bolted, but at the same time it's not saying that you have to necessarily throw your doors open to all either. It is kind of empowering each home, which I think sometimes it's nice to have something generic, because it means that you've got the backing, haven't you? Exactly. Yes, yeah, absolutely. But at the same time, it is kind of you do have the guidance there to make that call to protect your staff and residents.
Because it will depend on each individual environment, won't it, Amy? If you can't give space, or you've got issues with people maybe crossing in a corridor or too close or whatever, so there are still options to visit in alternative ways if that risk assessment proves that it would be more difficult in that environment to manage for whatever reason. But the risk assessment should identify what those risks are, because we do, and I think this is so important, we still need to have awareness that people's well-being will suffer hugely if they don't have visits and if they don't have contact with people, and that can be as fatal as sometimes the risk of getting the illness. And it's that making sure that we balance those risks as much as we can. And the difference between this round and last round is that this round more people have been double vaccinated, and the booster, and the more information we have about the booster as well, Raj, should be very helpful to us, because they're gathering more information about the effectiveness of that. And obviously it's only very soon that many people have had their booster, so we need more data about how effective that is as well. And we mustn't also forget the caregiver can go in, they can still go in, and we must not prevent them from going in unless that person is COVID positive. Raj.
I think the other Raj was first.
Oh, I beg your pardon. I'm so sorry.
All right. Okay. Yeah. This is only a general question. I'm, kind of advice I need. Where do we stand as a private care homes, not to save or that we not to we don't get any bad remarks from CQC or anyone to stop people coming during this Christmas time, because a lot of people, friends, they just want to pop in and give cards, right? Where do we stand on stopping that? No, sorry, drop the card through the post and that's it, rather than seeing a resident.
You should have a policy now, Raj, that clearly states you have to have 3 nominated individuals and a caregiver, and that should be very clear in your policy.
Yes, that's there, right? But people come very insistent. You get a call, somebody is really hard to explain them. That you get all these kind of calls coming in. People say, "I want to see," and that's where the problem comes in.
I completely understand, especially around Christmas time.
There are people who will not take no for the answer. Yeah, so that's the danger. So the next thing is, if you say it, they get very heated up and they ring up the social services and ring up that. And it's unwanted thing, right? And what they make up out of it, I don't know. Yeah, so that's what I'm worried about these days. I want to safeguard my residents and safeguard my staff. That's my highest priorities here at the moment.
Raj, I completely understand, and I'm sure there are lots of providers sitting around the table that will feel exactly the same, have exactly those same conversations with family and friends that do not understand the guidance. All you can do is reiterate it, refer them to the guidance on the website, up to them if they don't wish to read that, but you would be supported by any statutory organisation if you were to say, I'm so sorry, but you can't come in, because it is in guidance now, and it's to protect them. And I think if you could just keep explaining to them that you're having to follow guidance, you're not making this up, you're having to follow guidance. And if you want, if they want to make a complaint, then obviously they can do, and you'd welcome them making a complaint. Put it like that, you'd welcome them making a complaint, because obviously it's very upsetting for them, but they can make a complaint to the CQC, to the local authority, or to their local MP if they wish, but you are complying with the guidance.
Thank you. That's all I wanted to have clarification. Yeah. Thank you for doing that.
That's okay, Raj, and I do empathise with all of you that are having to have those really challenging conversations. The way that I would say to any residents, family and friends is we completely understand you would like to come in and see, whoever it is, Mrs. Smith, Mr. Jones, whoever, completely understand. However, it is just not possible at the moment. The guidance is very clear, because I'm sure they've heard on the television about Omicron and how quickly it's spreading. And let's hope by taking measures now, it will allow us to get back to what we had previously, which is more people being able to see residents. And that's what we want. Raj?
Yeah, I was just going to ask a question. During the first sort of few waves that we had, when there was an outbreak in a care home, you obviously had residents that were very ill, and then you also had staff that were isolating and off. So you ended up in a situation where many homes were requiring additional carers but had less. And bearing in mind that the staff shortages that many providers are facing now, I get a lot of calls and things from providers that say, look, who's going to help us if we have another outbreak over this winter period, particularly when our residents require more care, and if there is an outbreak and staff go down with it and we've got less people, we're already short of people, who do we call to help? And some of them fear retribution from quality assurance and CQC and everybody else, because they might feel inadequate in being able to do their job, but they obviously are going to struggle at a point where they can't get agency, you haven't got the staff, and we keep hearing on the news and things that, oh, the army's being called in and the Red Cross is being called in to do this, that and the other, and the whole of the NHS is going to do this and that and the other. But is there some sort of like emergency contingency for social care in Norfolk perhaps, where we can ring and say, look, we've got this massive problem, and staff are down, residents are down. Can someone come and help us?
Yeah.
Without
well, the thing is, Raj, that only gets stood up when the numbers are such that it's needed, and at the moment the numbers aren't such that they're needed. However, it's not to say that there aren't contingency plans being put into place as we speak, particularly in terms of shortage of staffing. So we're working across the system to look to identify people that can come back, that have retired, like you say, reservists, and then at a system level, they are identifying where there are shortages, and that would include within social care. So yes, it is absolutely part of a system review, and there are certain cells that are set up when there are particular crises that happen within the local authority, but also more generally as well. So unfortunately, we haven't got any of our Norfolk County Council colleagues on the call to talk to you about that, but there are cells that are set up specifically to address this. So yes.
I wonder whether it's possible to communicate that to providers across Norfolk, so that I mean, it's not like everyone's going to be calling every 5 minutes, but suddenly you do get situations where 20 staff have gone down with it, and all your home's sort of gone down with it, and you're struggling.
Well, number one, Raj, you would already have, if it's an outbreak, you would have the public health and multidisciplinary team in your home supporting you, and they as a team would identify who within the system they need to report to. So it is done through that process. And sorry, can I just bring in Judy or Rowan on this, because obviously if you've got an outbreak, that's the sort of discussion you have, isn't it, Rowan?
Yes, no, definitely. Yeah, I mean, with the last peak, or the last couple of peaks, yeah, we were involved in lots of discussions around getting bank and agency staff, and that I mean, they were in short supply, and it was quite an issue. But yeah, can we be more prepared on that front this time? I don't know if certainly we can get a stance from County Council around what that's looking like now in terms of contingency around numbers of agency and bank staff. It might be just useful to get a stance on that anyway. In fact, we're going on care providers meeting a bit later on, so we can ask that.
We can ask that there. Yeah, absolutely. Yeah. I certainly know as a system that we're looking at this.
It's a bit like the fire service.
It would be allocated out. Yeah, exactly. It would be allocated out according to the need as well. Judy, you wanted to come in.
Yeah, I was just going to reiterate what Rowan was just saying, and I know in following wave 2, with Christmas last year, we had some really challenging staffing situations in care providers, and I know following that there was some workforce discussions at Norfolk County Council. I don't know the outcome of that, but that is something that we can follow up to be a little bit on the front foot and prepared. Potentially if we need to be. So as Rowan said, we've got a meeting lunchtime, haven't we, with them, so we can pick that up with them then.
Thank you very much, and you make a really good point, Raj, as well, and it goes back to this what we don't, providers don't want to be in a situation that they were last time, where we're suggesting that you allow things to happen, and then once you allow things to happen, things escalate very quickly, and before you know it, you've got COVID throughout your home. So you want to try as best you can to protect your residents, your staff, and everyone else that's coming in the home from that infection. But I think, Raj, it's our moral dilemma of this year or 18 months, isn't it? It's the balance between health risks and viruses and psychological safety and well-being, and you're trying to balance them all the time. It's really tough. I wanted to move on to mandatory vaccinations for the wider social care and health sector, and I know we've got some home care providers here. I just want to ask a couple of questions. Ian, I know you're a domiciliary care home care provider. If when mandatory vaccinations are coming in, what sort of percentage of your staff at the moment are not double vaccinated and you may have an issue with? What's the sort of feel at the moment, Ian?
It's 3 out of 12 who I've got concerns that I've got a couple who were late to having their first, and it was only really my kind of saying, look, this is probably going to come in, you might want to get ahead of the curve, plus it's keeps you safe, etc., etc. And they had their first one a while back, and they're probably now on the verge of getting their second. But yeah, I've got 3 who have kind of held out this long, and last time I spoke to them, it's sort of, again, you just need to kind of consider this situation. A couple of them said, oh, when it comes in, I'll probably do it, but we'll see. So yeah, and in terms of potential impact, if they decide not to go ahead, I'm probably having to look at serving notice on some of our bigger packages, because we just won't have the staff cover to maintain those, and they're kind of living with double up kind of packages, which would be not great for us and obviously pretty bad for the clients. So obviously now obviously, I mean, it all got voted on this week, so I'm now at the point of sort of having those conversations again with staff, saying, yeah, what we thought was going to happen is now happening. This is the time scale. If you genuinely believe that you're medically exempt, this is a process to get that recorded properly. I am looking for some advice about how I actually check people's status. Appreciate it's probably not on the agenda today, but the sooner I can get that information, that'll definitely help me in terms of getting ahead of the curve. Because obviously, in a sense, it's not just 31st of March. Decisions basically need to be made kind of mid to late January, really, on terms of who's going to be given their notice if we have to hand back contracts about clients, that stuff. Early February is kind of a deadline for that, because it's 28 days notice for both. So yeah, I'm just kind of still kind of letting that kind of soak in for myself before I start emailing and writing to staff, because obviously I want to make sure I put it in the most supportive way that encourages them to get on board. But yeah, I know there's some hard calls coming in the new year, but it is what it is.
Ian, when you said supporting knowing what status that member of staff is, what do you mean by that? Do you mean that you need to know what their reasons are for self-exemption?
No, so I mean just basically how I actually have the evidence to show, yeah, I've confirmed that this person has had their 2 vaccines. But I mean, looking at the COVID pass, but from what I can see of it, if somebody's had an LFT the day before they download it, they'd possibly come up as green. It doesn't actually say, and I'd looked at it by looking at my own, and it doesn't, all it says is I've got a green COVID pass. It doesn't say I've had 2 vaccines and a booster. So that's the process I need to understand. And again, I don't want to sidetrack this meeting.
No, that's absolutely fine. So for care homes, what they do is you have the NHS app, but you also have access to a letter as well, and it identifies the ways in which you can identify the 2 vaccinations through the app.
Sure.
So the app is there to do that. Do any of your staff use the NHS app to identify
All
their
of us.
vaccination?
All
Yeah.
of us.
Yeah,
Yeah.
fine. Yeah,
Yeah.
because all you need to do, I say all you need to do it, that people have to download the NHS app, and it will be recorded on there.
Okay, so you can't. So you need to have it through the app and not just try to. Yeah. Okay. No, that's fine. I'll give that a go and see whether that.
There is in the guidance which will come out, but I'm sure it'll be exactly the same as it is for home care. It does give you exactly what evidence is acceptable in the guidance.
I've popped that in the chat as well.
Oh, thank you, Megan. So Ian, that's is that the one above? There we go. Yes, it tells you there, Ian, if that's helpful. And if you have any issues with that, I'm pretty certain the guidance isn't out yet for the wider health and social care sector. I'm right, aren't I, Rowan? I don't think Amy and Judy, you haven't had anything out at the moment in terms of guidance for this, for your double vaccinations?
No.
Sorry.
No, I don't think we. Oh, we're like buses.
So nothing at the moment, is there, for you?
No.
But when a manager has to identify if their staff have had the vaccine, this will probably be what you have to do. You probably have to have your NHS app, which is evidence that that person has had their vaccination.
And as you say, we're certainly aware that the little cards that you get given when you are vaccinated aren't sufficient official evidence anyway, but probably in the short term they're better than nothing. And
waiting for a letter to come, because you can actually get a letter as well. You can send off for a letter as well. Raj, you've got your hand up.
Yeah, I was just going to say, if people have got the NHS app, you can actually, one of the first options on there is download your pass, and there's actually then 2 options for some reason. One is a domestic pass, which gives you a QR code, which doesn't actually give you anything at all, and the second one is the travel one. And actually, if you click on the travel one, which is not really travel, it then gives you the option to PDF and send the pass, so you can email it or text it or whatever, and that gives you the letter. So I think the common mistake people make is that they click the domestic pass, which just gives you a QR code, which is not readable by anybody. And what they need to do is go into the travel one. So maybe some information to providers with almost a step-by-step, download the app, do this, do that, will give providers the information to pass on to their staff, and they can do that a lot easier than waiting for a letter.
Yeah, that might be helpful, actually. I don't know, Marcelo, if that would be helpful for you as well, although I guess you've got most of the information there now anyway, but we could have a look at that. I'm not sure, actually, if anything has already been done with that, but we can have a look for that, Raj. Obviously, in terms of health and the wider social care, it will come out in the guidance. Until we get it in the guidance, we can't do that for that group, because it might differ. Who knows, Raj? By next March, they might have a new app. Who knows? But certainly for care homes, we could do that, just as a sort of flow chart. That would be helpful. So thanks. Yeah, we'll have a look at that.
Also, what you've got is you've got an issue where you've got older care staff that aren't necessarily with, download an app, what's that?
Yeah, exactly.
I don't have this, or people don't have their NHS number, so information to provide, and managers can sit down with their staff and say, all right, I'm going to download this app for you, and we can do it for them, and it does make it a lot easier, and it's easier for them as well when they've got it on their phone.
Yeah, Brilliant. Okay, we can have a look at that. We can see what we can find out and do that. Thank you, Raj. That's a great idea. Thank you. I think there was just one last thing on the agenda, and that was our infection control and testing fund. It was there previously, just to remind people about it. It came out in October 2021, and it was going to be paid in 2 tranches. We've already heard Raj uses that funding for testing, but I presume other things as well for incentivising anything around infection control. But I just wondered if anybody else is using the infection control and testing fund at all and finds it useful. Marcella, do you know if you've got that? And
oh, Ian's got his hand up.
Oh, I beg your pardon. I'll come back to you in a minute, Marcella. Ian.
Yeah, no, I can't remember if it was one of these meetings or one of the other meetings. The suggestion had been made about actually paying staff for undertaking the testing, because particularly in home care, where we don't bring everyone into the office one day a week to test them, because I mean that would be properly insane to do. You know, so we actually literally this week I've introduced that, you know, we now pay staff to undertake the testing under their own steam, so they just now forward me the details of when they've tested, and if it's an LFT, we'll pay them 15 minutes. If it's a PCR once a week, it's half an hour. It's just a way of making sure that I'm getting better records around people's testing, and it's not just me documenting what kits I've handed out, but also it is actually, it's giving a little bit back to staff for actually doing it.
Oh, that's great, Ian. Thank you. And thank you for sharing that. I don't know if that's something other people have considered. I'm just going to see if I can bring in Caroline. Is Caroline still here? Yeah, Caroline. Caroline, is that something you've considered at all?
The staff have all been really good since all of this started, and they come in. They do their tests. They do them when they're on shift, whether it's day or night shift. They register it on the computer in the home, and all their test registrations come to my email address, so I know that they've all done it.
Oh, that's brilliant then. That's fantastic. Can I just ask you, whilst you're there, it's slightly at a tangent, but it's connected. Have you recorded all your vaccinations onto the capacity tracker?
Yes.
Yeah. So they're kept up to date. You don't have any kind of that's brilliant. And can I just ask, Carol, do you have any agency workers?
No.
Brilliant. No, that's fine. I was just going to ask about agency workers in a minute. Thank you, Caroline. That's great. That's great. Gibbs, how about you? How are you getting on with infection? I keep going to see the IPC fund, but it's not. It's Infection Control and Testing Fund. How are you getting on with that? Are you there, Gibbs? Are you muted? Let me just have a little look. Oh, you're muted, I think, at the moment. There we go. Hi, Gibbs.
All right. Thank you. Yeah, at the moment we are quite in line. We have got all the infection control equipment that we need: the gloves, the aprons, the gel, washing gel, and the gloves. Everything's order. We are also updating our capacity tracker on a daily basis and weekly basis to the council, and whereby we are stating exactly the amounts, the quantities that we still have, but we are still ordering as well through the PPH portal to keep our stocks above board. So yeah, and then I don't know, I was also thinking that maybe because we are using a fleet of cars, so I don't know how much help we can get in controlling infection in the cars, because we've got different people coming on a daily basis. So we're thinking that if we could have some infection control material that we can use, sprays maybe, like in the cars so that we disinfect the cars on a daily basis? Is that something that can be considered as well?
Well, it sounds to me like an infection control measure. I think the best person to talk about that with, or to email, is Sarah Armitage. Is just to email Sarah and just to clarify if that could be acceptable. I mean, if it's an infection control measure, I'm pretty certain it should be fine. But I would just have you got Sarah Armitage's email?
Yes, Sarah
Armitage.
Sarah Armitage.
Yeah, she's Norfolk County Council. Shall we just?
Okay. I think I have got her email. I think so.
I think.
Yeah, I'll check.
Probably. Yeah. But if not, let me just. I think just to clarify with her, because she's been the one that's been looking after that fund.
Okay.
I'll put it in the chat for you. It certainly sounds like something that could well be considered.
Yeah.
Yeah. Yes, thank you. Thank you very much.
Welcome.
Okay. What about yourselves at Arms Care, Raj and Trina? Do you have anything else that you're sort of using your infection control and testing funding for? Is Trina coming? Is Trina there? Is Trina there?
No, I think it's all been covered by just general costs. As I say, we've used it for bonuses for the staff for coming in to do their testings, and for literally for the infection control with the flu jabs and everything else. So it doesn't go as far as you'd like it to, but it's a start, isn't it?
Yeah, it's exactly, and got it extended to March 22 at the last moment, shall we say? So
yes.
Yes.
I think we also provided additional uniforms and things. Obviously, they're washing more and washing every day. And I think, Trina, did we supply washing tablets?
Yeah, and the laundry allowance at the beginning, because obviously until we could get the extra uniforms to them, they were having to wash them every day separately. So we gave them an allowance for the extra electricity and things that we're using at home.
Wow, that's really good. That's really good.
I mean, it's just one way of getting it back to the staff, really.
Yeah,
and that's what we wanted to do. And it also encourages them to think, oh, I need to wash my uniform. I'm getting a laundry allowance. Whether they do or not, you'll never know. But if you encourage them and say, look, there's £5 a week for an extra, putting your machine on and doing whatever, and here's some more uniforms. It's just every little bit is going to help, isn't it?
Definitely, Raj, and that's quite creative as well. I think that's especially with the infection control measures, anything that reduces risks is fantastic anyway. So yeah, it was a really good idea. Marcella, I think you were going to come in, weren't you? We were just about to speak, and then I was called elsewhere. So was there anything that you wanted to say?
Not necessarily, because I am not dealing with the fund. All the finance part of the business is our proprietor dealing with, right? But as far as I'm concerned, we don't have any problems.
Okay. Oh, that's really good. That's really good. And in terms of general infection control and stuff like that, are your staff really good at things like hand washing and changing their uniform, not coming in with wearing their uniform, taking it off, washing it at home, all of that sort of thing?
Yeah, they are very good. And I would like to mention, in October we have been in outbreak for 2 weeks because we had one resident and one member of staff positive in a period of 14 days, right? But we did manage to get over it, and we don't have any problems since, and we never had problems until then.
Oh, I know, it must have been so devastating.
Yeah, really, yeah.
Yeah. Well, that's fantastic. Raj, is that a legacy hand, or have you got your hand up?
I was just going to say, just going back to something that I think Gibbs said about cars and things, and I think that's very important because, I mean, I'm not in dom care or anything, but you've got people going from home to home to home, and of course, you need instruments to dispose of all your PPE in the back of the car, and I don't see why you can't have little mini fogging devices in the car so that when you've been to a client, as you get out the car, you spray the car so that it's got time to settle while you go and see to your client, and do that every time you get out of the car and let it. I can't see any reason why that isn't a possibility, because that is a working environment for people travelling in cars in a dom care environment. I know we got fogging machines, and some of them are quite big, but we also got some portable ones. So if Gibbs, if you want some info on getting those, then they're not expensive.
I was going to say, I think we've got our health colleagues that may have a different view about that, Raj. Amy, do you want to come in?
Hello, hi. It was just to say that although obviously some fogging can work and be effective, it's just really difficult, particularly with fogging things like cars, because you have such a vast array of different surfaces, and that those fogging droplets are going to have different times to settle on different surfaces. They generally aren't ideal for any soft furnishings because they sit and they're absorbed, and when someone sits on it, everything's displaced again into the air. So and obviously you need to follow all of the manufacturer's instructions about how they are to be used, and they can only disinfect what they land on. So the other issue there is that it's almost not a false sense of security, but thinking that a surface has been decontaminated, when obviously something like a steering wheel, for instance, it will only sit on a very small surface of that steering wheel. You'd have to rotate it all the way around, fogging several times, for that steering wheel to have even been touched by any of those droplets. So it might be quite challenging to effectively fog and then say a surface had been decontaminated. It's definitely, for a thorough decontamination, it's definitely worth looking more so into kind of the handheld wiping with the approved products all the way around the steering wheel, all over the door handles and things like that. I mean, I know there's a level of risk, and obviously following manufacturers' details around the products and the chemicals involved is definitely the best way forward. But I would say, yeah, fogging can be quite a challenge, particularly with lots of different materials in a confined space. So yeah, it's a tough one.
Yeah, so maybe taking the view that, Raj, that you still use that infection control and testing funding for equipment and products that can support cleaning the car. It's definitely something that you could purchase through the fund, because you're quite right, travelling in the car is an area which could get contaminated. So yeah, that makes sense, doesn't it?
Yeah.
Okay, all right then. Well, thanks. Thank you very much. Again, we've just gone over, but just a little bit. So I'm going to call the meeting to an end now. But thank you very much for attending.